Hello everyone, my name is Jean Tiberio and I'm a nutritionist and a wellness coach. I'd like to welcome you to Healing Outside the Box. Now this is episode 228 and I'm calling it Alzheimer's disease and heart disease. Are they connected? Because if they are connected, then perhaps we can use the same treatment recommendations for Alzheimer's that we now use for heart disease. And who knows, maybe some hope is better than none. But first, I just want to apologize to you guys for not keeping up with my weekly or almost weekly schedule on these episodes. I don't have a great excuse other than I was tied up with this thing or that thing and basically life got in the way. I would love to tell you all high and mighty that I just finished reading the Brothers Karamazov and I am now plunging into the Mueller report, but that's just plain fake news. Because by the time I was done with the Brothers Karamazov, I never got to the Mueller report. And lo and behold, we now already have the impeachment report. And my head hurts from listening to these guys fight with each other on both sides. But I really do enjoy finding out what's happening in the nutrition world and passing it along to you guys. This might be a good time to put out there that if you subscribe to my podcast, you will automatically get notifications when new episodes pop up. So you don't have to ask yourself, where the heck is that nutrition lady? Although most people like to subscribe on Apple Podcasts, you can also subscribe on Spotify or Google Podcasts or Castro or Pocket Casts or wherever you get your podcast episodes. If you want to ask me questions or suggest topics for future episodes, and ladies and gentlemen, the well does run dry, please email me on my website, Healing Outside the Box. I've got a contact page right on there, and I'll try to get back to you as soon as possible. And if you're already thinking about trying to knock off those extra few pounds around the first of the year, I am booking online nutrition and wellness coach sessions for the first of the year. So you can just contact me on that same website to get booked for a nutrition visit. Okay, back to Alzheimer's disease. I did 4 episodes on what we know right now about Alzheimer's disease related to diet and exercise. So feel free to go back and take a look at those episodes. Or should I say have a listen. They are episodes 158, 159, 160, and 161. I'll put links to them in the show notes. The thing that got me thinking about this whole topic once again is that I listened to a short nutritionfacts.org video that I'd like to pass along to you. I'll leave that in the show notes as well. It's by Dr. Michael Gregor, who's basically referring to Alzheimer's disease and asking the question, should we call it atherosclerosis of the brain? I don't know, let's see. He talks about a study that was published in 2016 that suggested the possibility that Alzheimer's disease is really atherosclerosis of the blood vessels in the brain. Or that's the way that perhaps we should be looking at it. I will get to that study in a minute, but first I want to give you some history around how we got here. Back in the old days, 1901 to be exact, Dr. Alzheimer from Germany first discovered these plaques and tangles on autopsy in a woman who had experienced memory loss, agitation, and debilitating symptoms we now know as Alzheimer's disease. He called it a unique disease process separate from general dementia. We have learned a lot since 1901, but we are still, of course, learning. Today we define Alzheimer's disease as the most common form of dementia. Alzheimer's disease overall is theorized to have many different contributing factors. It might be a little like cancer in that way. There seems to be a genetic predisposition. There may be a virus that could trigger tumor cell development. There may be oxidative damage to cells that can promote cancer. But the one thing that is undeniable is that diet and exercise are factors contributing to cancer that are within our ability to control. So again, Alzheimer's disease, and certainly cardiovascular disease in general, have risk factors that are within our control and factors that are not within our control. For example, one of the factors that may be out of our control might be a bacterial infection. The example they give is Chlamydia pneumoniae, which has been known to contribute to pneumonia, and that may lead to a higher risk of Alzheimer's disease. And certainly there is the genetic predisposition to developing Alzheimer's within families. But for the purpose of this podcast episode, I'm going to focus on the dietary factors. The video that I just listened to, and that I'm passing on to you, is from a search of the recent literature connecting the atherosclerosis process, or what we call hardening of the arteries, with Alzheimer's dementia. In the same autopsy, Dr. Alzheimer described what he saw as hardening of the arteries, or a narrowing of the opening in the arteries. More specifically, he called it hardening of the arteries of the brain. And remember, this is back in 1901, which, in terms of medical knowledge, was a long time ago. We know that atherosclerosis involves all arteries, not just the arteries inside the heart. Arteries that are also clogged or lined with plaque are the arteries in the brain and the carotid arteries on either side of your neck that bring the blood supply to the brain. So we now know that brain disease and dementia in general are linked to atherosclerosis, or hardening of the arteries. In other words, if you are at risk for a heart attack or stroke, the theory now is that you are at risk for Alzheimer's. Autopsies done recently of Alzheimer's patients shows the same clogging of the arteries of the brain that are seen in cardiac and other major arteries. By the way, the definition of an artery, as we all know the red blood vessels, are that they are the blood vessels that move the blood away from the heart and lungs and all the way to the little capillaries. The nutrients and oxygen in the blood are distributed to the cells as the arteries make their way down to the capillaries in your toes and fingers and eyes. The oxygenated red blood vessels make your blood red, but once they're in the capillaries and they start to head back, you no longer have oxygen and they turn blue. So blood flowing to the heart and lungs are your veins, and they're blue. In other words, deoxygenated or needing of oxygen. That's why it's only the arteries that get clogged. The dietary fat is in the arteries, not the veins, because it's already been deposited to the cells. So no dietary fat, no clogging. As we age, our brains become more sensitive to a lack of oxygen. And as that video shows, we can get a 50% blockage of that hole inside our arteries and not even be feeling any symptoms. By the time you feel angina or chest pain, you've got probably a 90 to 95% blockage in that hole or lumen in your arteries. So blockage is blockage, irregardless of which artery it happens to be in. Over the past 20 years, there are several studies linking cardiovascular disease to a higher risk of Alzheimer's. Fear not, though, because we are learning that the answer to preventing strokes, in other words, the clogging of those brain arteries, is a plant-strong, antioxidant-strong diet which is low in meat and fried foods. In other words, the Mediterranean diet. And I hate to say this to all the ketogenic diet people out there, but it's not the ketogenic diet. You will lose weight on a ketogenic diet, but it doesn't take too many high-fat meals to start depositing plaque on those arteries. Here's another study that Dr. Gregor was referring to. Researchers studied people with mild cognitive impairment over the following 4 years. And it was published about 5 years ago. The people with little or no atherosclerosis remained stable, but the people who already had plaque formation in the arteries got worse. The people with the most blockage in their arteries, as seen by CAT scans, suffered the fastest decline in cognitive impairment. The group with the most arterial blockage developed full-blown Alzheimer's disease in many cases. Okay, but does the treatment for cardiovascular disease help people with Alzheimer's? Well, they did another study. People who already had Alzheimer's were treated with a heart disease diet, and that was your plant-based, lots of antioxidants, little or no cholesterol, and they showed significantly less decline than the control group. As you might imagine, there have been more studies about dietary intervention in Alzheimer's disease. This was a study on mice. And yes, I know mice aren't as complicated since they don't smoke or get in stressful traffic jams, but in some ways it's better because we can relate dietary changes in a more clear fashion. So they gave these mice atherosclerosis, or hardening of the arteries, by feeding the mice saturated fat and cholesterol. And again, since mice generally don't smoke, this was about dietary habits and nothing else. The theory was that plaque did in fact build up in the arteries of these mice, but not just because of the fats. They theorized that there's lots going on. There's general inflammation, maybe due to both the effect of meats, especially processed meats, smoked meats, etc. There's oxidative free radicals that are being produced with such a diet. Perhaps these oxidative free radicals trigger our immune system, so then these immune cells, which are proteins that go in to try to fix things on the artery walls, and they just get mixed up in this whole mess. These immune cells they call macrophages, and they found that they become part of the plaque on the wall of the artery. And then there's more plaque, more cell wall injury, more immune cells go in, get caught in the plaque, and die, and on we go. So this mixture of fats, proteins, and dead cells become part of this accumulating plaque on the inside of the artery. Now we know that these proteins in Alzheimer's called amyloid plaques and tau tangles actually become part of the arterial wall plaque in the brain. They've actually done autopsies on patients with Alzheimer's that have passed and found these amyloid plaques and tau tangles on the artery wall. So what these authors suggest is this. In atherosclerosis, and perhaps in brain disorders characterized by protein accumulation, and that would also be Parkinson's as well as Alzheimer's, this evidence suggests that it would be better to focus on ways to fix the cell's waste disposal system for getting rid of these large protein clumps, rather than on ways to stop the clumps from forming. Here's another article from the American Journal of Alzheimer's Disease and Other Dementias, and this was published in 2013. The abstract states, quote, "The vascular risk factors can be present in cognitively intact individuals for decades before mild cognitive deficits or neuropathological signs are manifested. In that sense, they may be ticking time bombs before cognitive function is demolished. Preventative intervention of these modifiable vascular risk factors may delay or block progression of Alzheimer's disease. Intervention could target cerebral blood flow, since most vascular risk factors act to lower this blood flow in aging individuals by promoting cerebral vascular dysfunction." End quote. So what they're saying basically is working on preventative intervention decades ahead of time may not be what everyone wants to do, but it will be effective. The vascular risk factors they mention should come as no surprise. They are, number 1, lower cholesterol level to less than 200 milligrams per day, but really as close to 0 as possible. That would be best. Number 2, reduce hypertension. Reducing sodium linked to hypertension is a good idea, and that includes especially processed foods. Number 3, treat obesity. If a person is overweight, that's not the same type of risk factor they might have versus if they're obese. And obesity is defined as a BMI greater than 30. triglyceride might be one of the lipid numbers that should be less than 150. Okay, number 4, prevent or control diabetes. Type 2 we're talking about here. And number 5, increase physical activity. And that will also help raise the HDL, or good type of cholesterol. So some scientists are now considering Alzheimer's disease to be a vascular disorder, because atherosclerosis in the brain is reducing that blood supply to critical areas where blood flow is restricted in Alzheimer's patients. It all sounds like bad news, but it's actually good news, because atherosclerosis can get better with a significant change in dietary intake. So what this article and other similar articles are suggesting is that a plant-based diet that includes little or no dietary cholesterol can certainly slow down the plaque-building activity that creates this lack of blood flow in those critical areas of the brain. So once again, it's a whole foods diet, rich in plant foods, rich in antioxidants, fish, nuts and seeds, and fruits. That's the best diet to prevent what I think we can perhaps now call atherosclerosis of the brain. It's also coincidentally good for the environment. I don't know if any of you saw this with all the Trump-NATO blowing by with crazy town news and all, but the UN report on climate change that came out in November this year is telling everybody that we need to start doing stuff now. By the way, while we're on the subject of studies, basically telling us what we already know, I just read that the minimum amount of fiber generally recommended for good health is in the ballpark of 25 grams per day. But study after study shows that Americans get about half that much. And actually, less than 3% of Americans meet the 25-gram minimum that is recommended. One study was suggesting that if half the population took in 3 more grams of fiber per day, we would save billions in medical costs. Again, we probably know this, but fiber decreases the risk of diabetes, heart disease, certain cancers, and obesity. In addition to fiber in general, specifically oatmeal, which is the underrated king of the grains, in my opinion, can be anti-inflammatory as well. And this can help reduce cholesterol levels, as well as having some naturally occurring antioxidants. A recent study has shown that a plant-based diet with oatmeal as one of the foods actually was able to reverse the clogging of the arteries. So I think it's fair to say now that what's good for the arteries in your heart is good for the arteries in your brain. Just food for thought. That's all I have for you today. Be well and stay tuned next week for another episode of Healing Outside the Box.